a few more as we get moving. I do want to make sure we have time for all of our speakers today. So let's go ahead and get started. So good morning or good evening or good afternoon to everyone. Thanks so much for joining us today. I want to remind you that this plenary will be recorded, that it's available in English and Spanish. And I want to give a special thanks to our sponsors, Novartis, Novo Nordisk, and the Botnar Foundation, as well as, of course, to the ICUH for having us all here. My name is Jose Siri. I'm the Senior Science Lead for Cities, Urbanization, and Health with the Wellcome Trust's Our Planet, Our Health program. I'm really honored to be in this session on climate and urban health with some fantastic panelists. Of course, WHO and others have called climate change the greatest health challenge of the coming century. We know it will reshape our lives at all scales, from families and communities to entire societies. And in fact, we're already beginning to experience those impacts today, as anyone who's in the Pacific Northwest right now can attest to. And yet the urgency and the investment still don't match the scale of the projected health impacts and the scale of the risks. We know that cities can and must be a central part of the solution. And today our panelists will speak to challenges and opportunities from the standpoint of urban living, food systems, and diet, and what we can learn from cities in a range of geographies and settings around the world. So I'm going to go ahead and introduce our first speaker today, who's Dr. Karen Cito. Karen's the Frederick C. Hickson Professor of Geography and Urbanization Science at the Yale School of the Environment. She's one of the world's leading experts on contemporary urbanization and global environmental change. Her research has generated new knowledge on the links between urbanization and land use, food systems, biodiversity, and climate change. And among many other accomplishments, Dr. Cito is co-leading the Urban Mitigation Chapter for the IPCC 6th Assessment Report, having done so previously for the 5th assessment. She's an elected member of the U.S. National Academy of Sciences and a fellow of the American Association for the Advancement of Science. So Karen, the floor is yours.
Well, thanks, Jose. And it's really nice to be here. And it's nice to see so many folks participating in this panel. What I thought I would do today is really give this planetary perspective on urbanization and environmental sustainability. So zooming out of individual cities and zooming out of individual nation states and really looking at the global scale of urbanization. I want to start with this, this framework or perspective that urbanization is really at the center of a number of 21st century challenges. And we've heard that today, or actually we've heard that over the last 2 days for this conference. So whether it's climate change or health or economic development or broader issues around sustainable development, it's really clear that cities and the process of urbanizing is at the center of a number of these challenges. I want to put global urbanization in perspective. Every single week, we're seeing an average of about 1.3 million new urban dwellers on the planet. And so the question that I have is, or what I'd like to raise today is, what does this mean for a planet and what does this mean for global sustainability? So I'm going to briefly, in my brief time, just talk about 3 big challenges and also opportunities for land, food, and climate. Starting off with land, some trends that we see in the US, but also around the world. Home sizes, new home sizes are increasing. We see this in the US in the 1970s, average home size was about 1,600 square feet. Today, average home size is nearly 2,800 square feet. So these data are for the US, but actually we see this all around the world that new home sizes are increasing. For many parts of the world, this is really good news because home sizes were really small. But in many parts of the world, home sizes are just getting very large. But if you couple that with the average household size, we're seeing that average household sizes are declining in the US and all around the world. In the US, average household size has gone down from 3.5 in 1960, now down to just over 2.5. So on the one hand, you have home sizes are increasing, but average household sizes are declining. What that means is that we simply need a lot more land to build for cities. And so this is a picture taken in Bangalore, picture taken in China. What this means in terms of land is that we're expecting that about 20,000 American football fields will become urban every single day for the next 40 years. So if we aggregate all the new land that will be built for cities, it adds to 20,000 American football fields every single day. This is a lot of new land. At the same time, this is really an unprecedented opportunity because this also means that more than 60% of the area that we, in my lab, that we forecast to be urban in 2050, more than 60% of that has yet to be built. So there's a huge opportunity to shape the built environment in the coming decades. And I'm going to come back to this later on in my talk. So I want to switch to what urbanization means for food. There's really two parts of this equation. One is what urbanization means for supply. This is a picture from China where you can see that new housing development is abutting on or encroaching on agricultural land. So urbanization is going to have a huge impact on the supply of food, primarily through agriculture and the loss of agricultural land. But urbanization will have a huge impact on demand as well as tastes change. And we see this all around the world. In terms of the supply side, globally, what we expect, what we've seen work done in my lab is that we're expecting that we will lose about 2% of the world's cropland due to urban expansion. So globally, this is actually not a very big number. And if you talk to agricultural economists, they'll say that this will be made up by trade. But if you look at specific countries, such as the ones highlighted here, like Nigeria, Pakistan, Egypt, and Vietnam, there's going to be a lot of cropland loss in particular regions. So in Egypt, we expect to see up to 1/3 of the cropland lost due to urban expansion. And in Vietnam, up to about 10% of the cropland. And in many of these countries, it will be the most productive cropland that will be lost. So there will be knock-on effects, domino effects, where as the most productive croplands are lost to urban expansion, there will be new cropland that will expand into forests, rangelands, and wildlands as well. At the same time, what we're seeing is that with urbanization, there's also a really big shift in diets. There's the urban nutrition transition is well documented in a lot of countries. But the other thing we're seeing is that there's also a lot more food away from home. So these are data taken from 81 countries where you can see a very clear correlation between the percent of urban population in a country and the percent of food consumed away from home. We've also seen very similar patterns in terms of urbanization and food waste. And also packaged foods. So there's clearly a very big shift in diets. Now, there are clearly many links between urbanization and food systems. There's a lot of research on these two. This is what I've just shown, that there's links between the built-up area, the expansion of urban areas, and the loss of agricultural land. And there's a lot of research on how urbanization leads to increases in income and changes in diet. I think we'll hear a little bit about that later on in the panel. But there's a lot of other links between urbanization and food systems that are that really we have very little understanding of. And here I just want to highlight two things. Changes in lifestyle and culture. And I think a really good example of that is urbanization and pandemics and health issues. Changes, I mean, the fact that we're having this conference remotely, who would know all the changes that have happened, not only because of the lockdown and the pandemic, but as we build cities of tomorrow, who knew that we would be getting food, delivered at home, or groceries delivered. There are a lot of new innovations with regard to packaging, with regard to the cold chain. These are going to have big impacts on what we eat, how we eat, and the environmental implications are going to be significant. I want to just highlight one other thing here, which is about the cold chain. With urbanization, we're seeing that in many countries, people in cities are buying more processed foods, but also more foods that have to be refrigerated. And so there's a hidden environmental cost with the cold chain, because it's not just about the refrigerator in your home, but it's also the entire supply chain of keeping these foods cold, frozen, and fresh. So let me finish up with climate. This is a topic close to my heart. So Jose mentioned that I am currently leading the chapter for the UN climate report on how cities can mitigate climate change. We learned from the last IPCC report that urban areas account for about 3/4 of global fossil fuel CO2 emissions. I want to just underscore that a very small portion of the population account for a very large share of the global CO2 emissions. So you can see from this graph that about 50% of the world's population account for nearly 90% of the global carbon footprint. So it's really concentrated in a small percentage of the world population. But if we zoom in more into just looking at cities, you can see that the top 100 emitting cities account for about 18% of the global carbon footprint. And so it's a very small percentage of the cities around the world that account for a substantive portion of the carbon footprint. But again, there's a huge opportunity here, because how we build future cities will matter a lot. And remember, more than 60% of the future urban areas have yet to be built. And so there's a huge opportunity here. In terms of how we build the cities of tomorrow, it's really essential that we build under this LCUD. These are low carbon urban development scenarios. So these are scenarios where we build cities to be more walkable, more connected. And by connected, I mean, think about intersection densities, think about walkability, accessibility. So all the characteristics of urban design that make for healthier lifestyles are also better for the carbon footprint. But what you see here on the graph on the left is that under a business as usual scenario, so if we build cities as we have been building them, what we expect to see is that the urban energy use will increase more than threefold by 2050. And so we expect to see that cities are going to increasingly make up a larger share of the global greenhouse gas budget. So it's really essential that we build cities of tomorrow very differently than we have been building cities. But so that's how urbanization will affect the global climate, but urbanization will also greatly affect local climates as well. Work that we've done in the lab, we've shown that urban expansion is expected to increase local daytime temperatures up to 5.5 degrees C. So this is basically the urban heat island effect, but essentially what we're finding is that how cities expand over the next 20 to 30 years will greatly affect the urban heat island within cities. So you can imagine that cities are now affecting global climate, but they're also affecting local climate as well, primarily by how they are built. But it's not just the daytime temperatures that we really need to think about. It's also nighttime temperatures. And this is something that is really important to think about for this population in terms of thinking about urban health. There's a lot of research done on urban heat island and about daytime temperatures. But what we're finding with our models is that nighttime heat stress is expected to increase on average by 1 degree C and up to 2 to 3 degrees C. So this is important because most people are at home at night. A very small percentage of the workforce is working at night. And so one of the adaptation strategies for daytime has been cooling at workplaces, but adaptations strategies at nighttime will have to focus on what people can do to reduce temperatures in their homes, which will be really, really different. So I just want to end with a visualization, a very short visualization of what we expect cities to look like in 2050. Here we have cities today. This is a lights at night, so this is a global view. But we expect that, with in 2050, significant new urban development in South Asia, in Africa, and a big question if we think about environmental sustainability is how these cities will be built. It's going to greatly affect the global environment in terms of land, in terms of food, and certainly in terms of climate change. Thank you.
Thank you, Karen. Really fantastic visual presentation. And I really appreciate your focus on the opportunity that we have in the fact that most of our urban infrastructure is not yet built. So it's really an opportunity for imagination and creativity and tinkering and finding new ways to make sure that our cities promote both our health, but also the health of the planet. So our next speaker will take a little bit of a deeper dive into issues around nutrition and food, which Karen already has brought up. Dr. Juan Rivera is the General Director of the National Institute of Public Health in Mexico and Professor of Nutrition at the Mexican School of Public Health. His accomplishments are too long to list, but among other things, he's a member of the National Academy of Medicine and the Mexican Academy of Sciences, the founding director of the Center for Nutrition and Health Research at INSP, and a member of the Eat Lancet Commission on Healthy Diets for Sustainable Food Systems. He's authored over 500 publications, and he studies the epidemiology of malnutrition in all its forms with a view towards lasting solutions. So Juan.
Thank you very much, Jose, for the introduction. And thank you very much for inviting me to this fascinating symposium. And Karen did a wonderful job setting the stage between the relationship between urbanization and climate change. And I'm going to talk about diet as a driver of health and climate.
Juan, I think you've muted yourself.
Sorry. So food is the single strongest lever to optimize human health and environmental sustainability on Earth. However, our food system is currently failing us. Although we are feeding almost 8 billion people, which is really an accomplishment, our food system has not eradicated hunger and malnutrition and is contributing to a pandemic of obesity and non-communicable diseases. So unhealthy diets today pose a great risk to morbidity and mortality. And I think that we all know about this relationship between food and health. What is probably less known is how food system affects planetary health. So of course, climate change, but more than that, I would say planetary health. So the global production of food threatens climate stability and ecosystem resilience, and is the single largest driver of environmental degradation in general. Agriculture occupies about 40% of the global land. Food production is responsible for about 30% of the global greenhouse gas emissions and 70% of the freshwater use. Conversion of natural ecosystems to croplands that happen every day, all the time, and pastures is the largest factor causing species to be threatened with extinction. And the overuse and misuse of nitrogen and phosphorus in our food production causes eutrophication and dead zones in lakes and coastal zones. In summary, our food system is degrading our planet. And I would really like to show you that it is really urgent to reconsider our food system. In 2050, we will need to feed nearly 10 billion people, almost 2 billion more than we are feeding today. Some environmental systems are already beyond safe boundaries, and it is urgent to reconsider what foods should we eat and how should we produce them. On the right side of the screen, you can see the systems that are now beyond the safe boundary limits or the ecological ceiling. And you can see climate change, you can see nitrogen and phosphorus loading, land conversion, biodiversity loss. So we have to do something today. So the question addressed by the Eat Lancet Commission that I will really discuss today is how can we feed 10 billion people in 2050 with a healthy diet that simultaneously will ensure the sustainability of our planet. These are the environmental effects per serving of food produced for different food groups. You can see the food groups here on the left side. And I would just like you to show that animal source food really has huge impacts on greenhouse gas emissions, particularly ruminant meat. The first column is greenhouse gas emissions. And so this is a huge impact, but not only on greenhouse gas emissions, but also on land use. Ruminant meat, again, has a huge impact. Then energy use, you can see that most of the animal source food have very high impacts, acidification potential and eutrophication potential. And if you compare that to vegetables, to soybeans, legumes, vegetables, fruit, cereals, the impact on the environment is much lower. So you can start to imagine, you know, what the Eat Lancet Commission found out in terms of what is the best diet for us. So a very interesting exercise we did was to compare, you know, the impact of the different ecosystems, the greenhouse emissions, cropland use, freshwater use, on the planetary boundaries, on the ceiling beyond which we are really in danger. And that ceiling is here on this red line, that is 100%. And in 2010, I showed that graph, that figure before, greenhouse gas emissions were already above the ceiling. The same happened to nitrogen application and phosphorus application. Now, if we don't do anything in terms of our diets and the way we produce our food, in 2050, we're going to go beyond the planetary boundaries for every single system: greenhouse gas emissions, cropland use, freshwater use, nitrogen application, phosphorus application. And this will have a huge impact on the survival of several species, including our own species. So the Lancet Commission proposed 3 main actions to avoid this: a healthy and sustainable diet, so we should shift from our current diet to a healthy diet; reduction of food losses and waste, about 30% of all the food produced is lost or waste in the process; and sustainable food production. And we talk about sustainable food production, you know, the use of techniques that are already available, that many countries and many regions are using them, but many others are not. So that to close that gap in terms of the technology for production. So this is the healthy and sustainable diet that we are proposing. And you have the numbers there, but the most important thing is the figure. You can see that about 50% of all we eat in volume, we are proposing to be fruits and vegetables, about half a kilo. Then whole grains, here in yellow, about 230 grams. Then plant source proteins, which means legumes and nuts, 125 grams. Added fats, particularly unsaturated fats, and all of them vegetable fats. And then very small amounts, or I would say reasonable amounts of whole milk and equivalents, about 250 grams. Then animal source protein, 84 grams per day. But if you see red meat, only 14 grams per day, which means that, I mean, it would be reasonable to think about eating only once a week or once every 2 weeks if you really want to continue eating those huge amounts of meat that we are consuming today. And then, of course, avoid as much as possible added sugars, which are causing a lot of health problems in the world. So this diet is estimated to prevent about 11 million excess deaths per year in adults. So this will have a huge impact on health, but as we will see, it will have also an impact on the planetary health. So this is the current intake versus the healthy reference diet. The healthy reference diet is this black line, and you can see that everybody's consuming more than we recommend for red meat, except South Asia. Starchy vegetables also consume in excess in most countries. Eggs, in most countries, also an excess consumption. Poultry, there is a mixed look. In general, the overall consumption of poultry is below what is recommended. Dairy food is below what is recommended. Fish is also below, except for one region. And then vegetables, fruits, legumes, whole grains, and nuts, very low in comparison to the reference diet. Now we go back to this graph to this figure that I showed you before, just to look at what would mean to implement the three measures. So if we implement healthy diets immediately in 2050, despite the population growth, if we move to this type of diet, then the greenhouse gas emissions will be below the boundaries, and of course also the fresh water use. If we improve the techniques for production, we use sustainable production, cropland use will be below, and also phosphorus application. But if we do the combination of the three measures, all of our systems will be below the boundaries. So the good news is that the Commission concluded that feeding 10 billion people a healthy diet with safe planetary boundaries is possible with the combination of the three proposed interventions. And this will, of course, improve the health and well-being of millions of people and will allow us to pass on to our children a viable planet. Now, very fast, I will show you that this, of course, I mean, this will make a difference, but how can we achieve this? That's the big problem. And you can see, this is my own country, and in blue, you have the reference diet, and in yellow, you have Mexican adults, and then red, urban population, green, rural population. So for example, urban population in Mexico is consuming too little whole grains. We are consuming very, very, very refined grains. We are consuming too little vegetables, fruits, dairy in urban areas. We are consuming too much in rural areas, too little. But then look at red meat. Everybody's consuming above. Poultry, rural population is fine, but urban population is consuming too much. Legumes, everybody's consuming less than recommended. And then added sugars, everybody's consuming more. Mexico is a champion in the consumption of sugar-sweetened beverages, unfortunately. So urban areas, the urban population is really demanding a lot of the food that is harming the planet and our health. And in Mexico, urban population represents about 76% of the total population, 97 million people. So the changes required in Mexico are increases of vegetable, fruits, legumes, nuts, seeds, mixed recommendations for milk and dairy, increase in rural, reducing urban, and substantial reduction in added sugars, refined grains, processed meat, and red meat. And we are proposing that this can be done through some policies. For example, the increase of healthy food, we could do it if we shift agricultural subsidies that are currently subsidizing a lot of unhealthy food to these foods. Increase the availability of this food in underserved rural areas. It's amazing that in rural areas, you don't find vegetables or fruits other than the one locally produced. Prioritize these foods for government procurement And then healthy foods in the school feeding programs. We already have some of the policies that are marked with an asterisk, but we need to improve them. And then in the meat recommendations of intake of milk, we have a subsidized milk program that should be targeted to rural communities. Currently, it is targeted to urban communities. And then in the reduction of added sugars, refined grain, processed meat, and red meat, double the rate of taxes to sugar-sweetened beverages and junk food. Mexico was one of the first countries that implemented the taxes, but we need to increase them in order to reduce the intake of added sugar, use tax revenues to ensure drinking waters in underserved communities, front opaque warning labels of unhealthy food. We finally passed that law last year. Marketing restrictions to children and food standards for schools. However, our labeling system, our taxes do not go, for example, to processed meat that unfortunately is currently consumed by many, many children. So the 5 strategies for a great food transformation proposed by the Lancet Commission is seek international and national commitment to shift towards healthy diets, reorient agricultural priorities from producing high quantities of food to producing healthy food, sustainably intensify food production to increase high quality food output, strong and coordinated governance of land and oceans, and finally, to reduce food losses and waste in line with the Sustainable Development Goals. Thank you very much.
Thank you, Dr. Rivera. That was a really great presentation. A really good presentation of the complexity of food systems and their interactions with other elements of sustainability. I especially like the idea of the food system as a lever for change. And certainly the planetary boundaries framework is one that's extremely important for understanding the safe limits on our collective action. I will say as an aside, I sit in a planetary health group, so it's something that Wellcome thinks is very important. And we're very proud that we are co-funders of the EAT Foundation. So our next speaker will be Heidi Tukanen. She's a senior expert at the Stockholm Environment Institute. Her work focuses on sustainable development related to governance and decision-making processes, and most recently on processes related to urban planning and urban development. She has a master's degree in urban environmental management and is currently working on her PhD related to the local level climate adaptation and disaster risk reduction at the University of Helsinki. We have Heidi's presentation pre-recorded today, but she will be available for questions and answers. So if you have any questions, please do save them up. And in this presentation, we'll be going a little bit more into more granular detail on these issues. So if I could ask the organizers to share that presentation, that would be great.
Thank you for having me here as part of the ICUH conference to speak about our work. My name is Heidi Tukanen, and I'm a senior expert at the Stockholm Environment Institute Tallinn Center. Today I'll be speaking about SEI's work on secondary cities, urban form, and well-being. For those of you who aren't familiar with Stockholm Environment Institute, SEI is a global research-based think tank that works at the intersection of environment and development. We have 8 centers worldwide, 6 of which are involved in this project. How do urban spaces we spend time in affect our well-being? And how can we plan cities to support well-being? This is our focus in the City Health and Well-being Initiative. We look at publicly accessible space in 2 secondary cities in the low and middle income country context, Udon Thani, Thailand, and Nakuru, Kenya. In our work in these 2 cities, we've explored a number of different issues using participatory methods related to well-being and the environment. This includes heart rate variability experiments to assess differences in physiological stress across different urban settings. We've set up co-located pollution monitoring for noise, particulates, and carbon monoxide to see how pollution impacts the stress. In Udon Thani, we've done participatory waste mapping, and in Nakuru, we've done a water fluorosis study. And something I'll talk about later is a participatory mapping exercise on public space use. The idea is to get a holistic view of how urban form, environmental quality, and neighborhoods influence resident well-being. Over the next few decades, our cities will face multiple development challenges. We know that growing cities mean that we need to identify how to maximize the opportunities that cities offer, which means taking advantage of these opportunities to create well-being alongside other priorities such as economic development. Publicly accessible space, both built and natural, contribute to the livability of our cities in different ways. Even in cities, humans are dependent on nature through what are called ecosystem services. Unfortunately, in many rapidly changing cities, green spaces, those natural spaces, are under pressure to be redeveloped to meet economic demands. This is particularly the case in secondary cities where development pressures are often the highest due to growth, but governance and planning systems may be less effective and be using limited resources. Especially within the context of future climate change, planning that overlooks the benefits of well-protected and maintained green spaces or green infrastructure on societal well-being risks locking cities into negative development pathways. This could leave cities, or at least some areas of cities, left without the conditions that are required for the promotion of well-being. Often we find that formal green space is, due to historic reasons, unevenly distributed across cities, and thus people have very different levels of access to it. So taking a well-being lens to urban planning, it can complement other priorities, including climate change mitigation and urban resilience. Evidence from previous studies show that even in urban spaces, nature is good for us. It can improve our physical and psychological well-being. Most of this evidence, however, is from the global north. A better understanding of the factors creating well-being in the different types of settings is needed to ensure that urban space provides multiple societal benefits, especially in the pressure to densify. Our work rests upon the concept of ecosystem services. These are goods and services that nature provides for people. They're commonly divided into the following 4 categories: supporting, provisioning, cultural, and regulating. The goods and services are reflected in how we use nature for our benefit and includes things like the food we eat, the wood we use for building. However, many of these services happen in the background through pollination, cleaning our air and water, and services that are really important for cities with regard to climate adaptation, mitigating flooding, and cooling temperatures. Cultural ecosystem services refer to the intangible services, such as providing a place for us for recreation, the aesthetics, learning, and spiritual life. They are very culturally specific, meaning that the benefits differ from culture to culture. The importance of the urban nature for these cultural ecosystem services has been evident during the COVID-19 pandemic in areas where green areas have been accessible to people. The basic premise here is that if we enable it, nature can provide these ecosystem services for free. And these ecosystem services form the foundation for human well-being. Considering health and well-being in relation to the environment means that individuals should not only live in a clean and safe space, but also have the opportunity to live, act, and move around in health-promoting locations. The environment should also enable them to connect with others and enable them to fulfill themselves. Probably everybody can think about how the environment supports their own well-being. Recent global policy discourses have centered around nature-based solutions and green infrastructure. Green infrastructure uses vegetation, soils, and other elements and practices to restore some of the natural processes required to manage water and create healthier environments. Nature-based solutions is a similar term, but is looking from the perspective of solving a problem such as climate change adaptation, biodiversity loss, or disaster risk reduction using nature-based elements. Nature-based solutions and green infrastructure are hot topics because of their ability to support not only climate change adaptation, but also to enable multiple benefits, even in an urban environment. Planning effective green infrastructure takes a lot of input. It requires understanding a city, knowing the needs and the risks also that it faces in the future. It's also important to understand how its residents use different kinds of spaces and why. In order to understand this better in Udantani and Nakuru, we did a participatory mapping exercise where we asked residents in different neighborhoods to place a sticker on the map to show their favorite places for relaxing, exercising, and socializing. We also asked them which place they felt was most stressful. We followed this up with asking them about why they felt that it was most stressful or why it was their favorite location for these activities. We analyzed this data together with spatial data, together also with Google Images, as well as input from our local counterparts. Understanding how people use specific areas and the reasons for this use is important to understanding how these locations support their well-being. This information can also be used by planners to plan better urban spaces, which do maximize these benefits and avoid the negative impacts. This graphic shows the breakdown of cultural ecosystem services into different components which interact with each other: environmental spaces, cultural practices, which are the activities that take place in those spaces, as well as the cultural ecosystem benefits, which is another term for the well-being benefits. In this graph, we show our results of the participatory mapping exercise broken down for natural spaces in both of the cities. Because we are asking about specific activities, namely relaxing, socializing, and exercising, then the cultural practices clearly give us more details on those. However, interesting for us is the breakdown of the well-being benefits. This is seen in the red box. And these benefits are broken down according to identities associated with the spaces, experiences in the spaces, or capacities developed in the spaces. People benefit in various ways from natural spaces, and the answers between the two cities show some similarity. There's also some similarity or overlap between the benefits gained from natural spaces as well as built spaces, and these are seen in bold. Our results show that very different ecosystems, like the tropical savanna of Udon Thani and the warm Mediterranean of Nakuru, can provide similar cultural ecosystem services. Also, both the built environment and the natural environment are important to socializing, exercising, and relaxing, and thus are key to providing those well-being benefits. In both of the cities, the built environment was really important for socializing. However, it was also the main environment linked with stress. Of course, there were differences also between the cities, including how much proximity to a green space or a space affected its use, or whether affordability affected the use. There was also differences in why people considered an area to be stressful, whether it was congestion and busyness or antisocial behavior and crime. So what does this mean for well-being? First of all, built and natural environments have distinct but complementary roles in supporting well-being. Also, participatory mapping is one tool that could be used to highlight opportunities related to improving the benefits of urban space. This could be a tool used by urban planners. And while there's typically a focus on planning green spaces, we also see there's an opportunity for greening the dispersed spaces, ones that are accessible, highly accessible, and frequently used, for example, from moving from point A to point B in the city. It could be that greening these marginal areas could support more equitable distribution of benefits across society, and this is especially true in areas where more formal green areas are less equitably distributed across neighborhoods currently. Finally, also related to built spaces, our results show that in both of the cities, natural spaces were used to balance the stress associated with built space. It's interesting to consider to what extent these could be greened to lessen the stress or have calming effects. We're also exploring the connection between cultural ecosystem service dimensions to a holistic personal well-being framework. This framework, called the 5 Ways to Well-being framework, was developed by the New Economics Foundation as a set of evidence-based actions to improve personal well-being and public health. The 5 ways are specific actions that can be built into people's everyday lives. Connecting with family, friends, and neighbors, being active physically, taking notice, being aware of the world and reflecting on your experiences, keeping learning for enjoyment and increased confidence, and giving through engagement with others. Participation in each of the elements has been demonstrated to bring about improvements in personal subjective well-being, but actually significant gains are demonstrated when individuals can combine actions. So for example, we would expect a gain in benefits when taking notice of the spiritual or aesthetic value of a location, which can also connect people to their environment through the sense of place or shared cultural heritage. There we could see the connection between 2 of the ways, connect and taking notice. Analyzing the results within such a framework might also provide insights into maximizing well-being benefits related to urban space. Thank you, and I would love to get your feedback or take any questions.
Great. Thanks to Hedy for providing that presentation. There will be time for questions at the end. I was really happy to see a few things there. First, a focus on nature, which provides so many benefits for both health and environment in cities. I think the focus on secondary cities, particularly in the Global South, is really important because there's so much less information and so much less study. So both for those types of contexts and other less well-resourced, less well understood contexts like informal settlements within cities, we need much more attention so that no one's left behind. A third element was the importance and the value of participation and of including people's perspectives and knowledge and information gathering and so on and so forth, and really understanding what's going on. So I do want to point out, you can ask questions in the chat, and I'll ask our speakers to answer those questions if they can. In the meantime, we'll move on to our final speaker. Dr. Renzo Guinto is Associate Professor of the Practice of Global Public Health, Inaugural Director of the Planetary and Global Health Program of the St. Luke's Medical Center College of Medicine in the Philippines, and the Chief Planetary Doctor of PH Lab, a think and do tank for advancing the health of people and planet. He's a member of numerous high-level boards, including the Lancet Chatham House, a commission on improving population health post-COVID-19, the Lancet One Health Commission, and the Advisory Council of Global Health 50/50. He was recently featured by Tatler magazine as one of 400 leaders of tomorrow who are shaping Asia's future. So Renzo, I'll pass it to you.
Thank you very much, Jose. And it's really a pleasure to be here at the International Conference on Urban Health. Let me share with you my screen. And again, good evening from Manila. I'm not sure if I'm the only one from this part of the world who's still awake joining this important conference. But I guess that's the reason why I'll be talking about cities, especially here in Asia, and what are the lessons that can be learned in the era of climate change and planetary health. Actually, I think my presentation will really reinforce what we already heard from our first three speakers. And let me start by reminding us all that more than half of the world's megacities are actually located in Asia, as you can see on this map. And Asia and these cities are certainly facing the threat of climate change. It's already unfolding now in front of our very eyes, as you can see in these several headlines. And zooming into Southeast Asia, which is where my home country, the Philippines, is located, you can see here it's a climate hotspot. And in this map, the redder the country is, the more vulnerable the country is to climate change. And unfortunately, my home country, the Philippines, is the reddest of them all. And as a whole, the region is projected to experience increasing average temperatures until 2050, as you can see in these maps. And it's already being felt in many Asian cities, from the hotter and drier cities all the way to the others in the region. So we're seeing now increasing temperature, but also decreasing precipitation, as you can see here, some of the major cities in the region. And climate change is also manifesting not just in terms of increased temperature and decreased precipitation, but also we're seeing an increase in the intensity of extreme weather events such as typhoons and intense flooding, for instance, in the Philippines. And this is very true even during the time of the pandemic. Filipinos, urban settlers, those who are living in the margins, had to confront a dilemma. On one hand, do I stay in the house, protect myself from COVID, but perhaps my house will get inundated by the intense flooding, or the roof might be blown away by the strong wind. On the other hand, I can move to these cramped evacuation centers, temporary shelters, safe from climate change, but facing a high risk of contracting the unseen coronavirus because, as you can see in these shelters, there's no social distancing to begin with. So, in some of these places here in this region, we've also seen the confluence of both the COVID crisis and the climate crisis. Of course, we know that climate change is driven by the emissions of greenhouse gases, which and the sources of these greenhouse gases are also the same sources of air pollution, particulate matter. And here you will see some of the latest information about not just the economic damage, but also the health consequences of air pollution in some of the major Asian cities. And so really addressing the causes of climate change will also improve air quality in some of the mega cities and even the secondary cities in this part of the world. And climate change is also manifesting in terms of sea level rise and the inundation of many low-lying sections of major cities in the region: China, Bangladesh, Indonesia, Bangkok, and so we also need to think about how to address the health impacts of sea level rise and coastal flooding in many of these coastal cities in Asia. In fact, in the Philippines, here in Manila, it is expected and projected that by 2050, the whole city could be underwater. And so really actions are very much needed now to make sure that this does not happen, but also that people are able to adapt to this new normal. We're already talking about the new normal brought about by COVID, but as these other climate realities continue to unfold, perhaps newer normals will need to be imagined even prepared for. So we know that climate change and the many phenomena that I mentioned a while ago that are very much present and felt in Asian cities will have a wide range of health impacts. I'll not belabor you with this diagram, but as you can see, there are many pathways that link climate change to human health outcomes. And as you can see on the right, there's no single disease group that is immune to the impacts of climate change. Infectious diseases, chronic diseases, reversals in nutritional gains are also expected, but also there's an increasing evidence on the impacts of climate change on mental health, both in terms of abrupt disasters, but also the more slow onset ecological anxiety that, for instance, sea level rise in coastal communities may bring about. But also, and a while ago I heard that we should not just dwell on the problems, but also explore what are the opportunities. And I think we should be talking more and more about the health co-benefits of climate mitigation, better urban planning, but also changes in the transport system, in the energy system, in the food system, all of which are very much present in the urban environment. And as we address climate change, we will be able to avert the effects that I mentioned a while ago, but also we will be able to reap the health co-benefits, both to physical, and also to mental health. So what are Asian cities currently doing? And I don't want to end my presentation by giving you a gloom and doom picture of, again, the climate realities in this region. And there have been several, books and articles already written about how Asian cities are combating and preparing and addressing climate change, both in terms of mitigation, but also adaptation. But there's a particular document published by the Asian Development Bank just last month, June 2021, showcasing climate actions from different Asian cities. So I would love to invite you to take a look at it and Google it. And I'll just show to you some of the very interesting maps that are featured in that document. A lot of innovative projects in the area of clean and renewable energy in many different Asian cities. So this is very good news, as well as a lot of urban transport and mobility projects, which we know will also not just allow us to adapt to climate change, but also enable us to reap health co-benefits, and also sustainable and low carbon communities. So provision, for instance, of infrastructure, social services that are low carbon, also nature-based solutions. So again, I'll not go into detail, but as you can see, there's so many examples from this part of the world. And there's even a separate report just on China alone. We know that China has made strong commitments to climate mitigation as part of their obligation under the Paris Agreement. By 2030, they plan to reach peak emissions. By 2060, they want to be carbon neutral. And so, these are just some of the projects that hopefully will enable China as one of the major emitters of the world to be able to achieve the Paris goals. What are the other examples? So here, as you can see, the pandemic also opened new opportunities. Perhaps this is the silver lining of the pandemic. People are now, demanding for changes and massive changes. For instance, when the whole Metro Manila was in lockdown, by the way, the Philippines has the longest lockdown in the world until today. We're still under lockdown. But the lockdowns that led to disruptions in the transport system, especially for the health professionals, pushed local governments and cities to actually establish bike lanes. And as you can see in these headlines, hundreds of kilometers of bike lanes have already been instituted in the major cities of the Philippines. This enables improved mobility in the time of lockdown, but also, as we already know, it will also help us reap some health co-benefits, cleaner air, and more physical activity, for instance. And Dr. Rivera talked already about the planetary health diet, and I'm happy to actually report to him that the whole city of Metro Manila committed to realizing the planetary health diet, to feed the citizens of Manila. Of course, this is not an easy feat, but this is a very important first step to really, announce and commit to this new form of diet. And so hopefully in the coming years, we will see more, developments in trying to achieve this goal. As I've told you, Asian cities are now, some of them are sinking. Jakarta, for instance, is sinking, partly due to climate change, due to groundwater depletion, also due to land subsidence. But instead of just putting sea walls and elevating some of their sections, they decided to move the capital city altogether to another island. And so this is just one example of how cities, low-lying cities, are also preparing for that climate unstable future. And we have, Japan with all of its 400 plus cities committing to zero carbon emissions by 2050. So really ambitious targets from Asian cities, for instance, in Japan. And then in India, they adopted the climate smart concept. We know that climate smart is the convergence between mitigation, lowering our emissions, but also adaptation, because unfortunately, we've already reached some degree of inevitable climate change. The health impacts are already being experienced in some parts of the world. And so, the climate smart framework is deemed useful by some cities and settlements around the world, including in Asia. And this is an interesting example from Bangladesh. We know that Bangladesh, especially the areas that are in the delta, are really facing the threat of sea level rise. And so Bangladesh is investing in the smaller secondary cities where they anticipate people to be moving from the coastlines to the more inner part, of the country. And so this is just one example also of how cities are now adapting not just to their own citizens, but also to the citizens or the people that they're expecting to receive when climate-induced migration occurs. And then Singapore, which is, a very rich city-state, is putting a lot of money in terms of, again, making sure they're able to overcome sea level rise, but also increasing temperatures. It's very hot already in Singapore. We can expect even hotter days in that country in the coming years. And so they're really investing even in data science-based innovations, for predicting temperatures and informing the public, so on and so forth. So I'm proceeding to the last part of my talk, and I'm not going to detail. This is just to remind us all that yes, we live in the era of climate change, but we also live in the era of other massive global environmental changes that are anthropogenic in nature due to our consumption and production patterns, are the demographic shifts, urbanization, of course, migration, population growth, etc., and technological advancement, all leading to these environmental changes, which in turn will generate a wide range of negative health outcomes. And Dr. Rivera also mentioned already the planetary boundaries, so I'll not go into detail. And it just shows to you this framework of the planetary boundaries that was developed by the Stockholm Resilience Center. Climate change is just one of the many boundaries, of the 9 boundaries that we have to protect, that we cannot violate, otherwise the world will become less conducive for the survival of human civilization. And so I would urge you, because I think we've already mentioned the term planetary health several times for the past nearly an hour, but no one has actually defined it. And so I think we need to really shift and even expand our vision from public health, the health of people alone, to planetary health, the health of people and planet. And as a physician, the way I simply put it is I now have 2 patients, people and also the planet on which our health and survival depends. And so in the Philippines, we have established Planetary Health Philippines, a growing community that is interdisciplinary, intersectoral, intergenerational, and even international, because we are also trying to harness the brain gain coming from the Filipino diaspora around the world. And actually today, we have this editorial published in the Lancet Planetary Health announcing our new network. So, during the time of COVID, we've seen this graph over and over again in social media. We need to flatten the curve of COVID-19. We have to increase the healthcare system's capacity, add more beds, recruit more nurses, roll out more vaccines. I think that the same mantra is applicable to the climate crisis and the planetary health challenges that we have. We have to bend our curve. We have to flatten our carbon emissions and our ecological footprint. But the major difference is that the Earth's capacity cannot be expanded, cannot be changed. It's non-negotiable. And therefore, the only option is we really have to change our actions. And we need to make use of the COVID recovery process to make sure that our future is green, healthy, and just. And I'm starting to get concerned because a lot of the recovery, efforts, the stimulus packages that we're seeing now among countries are not necessarily considering climate change, the planet's health, and we are at the high risk of returning to the old normal, which by the way is abnormal. So we should refrain from, calling it old normal versus new normal. That's abnormal. And, finally, we have to talk about the larger economy on which the cities and our ways of life really depend on. And we need more PPEs, personal protective equipment for sure, as we try to still weather the pandemic. But another PPE that we need is a people and planet oriented economy. And this PPE should be an economy that protects the planetary boundaries, but at the same time meets the social foundation of humanity, and making sure inequities are not exacerbated and gaps are being closed. So as you might be familiar with the donut economy, which is developed by Kate Rayworth, an expansion of the planetary boundaries framework. It's now being adopted by the city of Amsterdam as their post-coronavirus economic model. Other cities are also considering it. So we should be talking more about how we can transform the economy to make sure that it's pro-people and pro-planet, with cities as the engines of that new economic model. Because we owe it to our children and we owe it to the generations that are yet to come. So together, let's advance the health of people and planet. Thank you very much, and I look forward to our conversation.
Great, thank you, Renzo. It's fantastic to have a regional perspective in such granular detail, and I'm sure that the audience members can relate to the examples that you shared from their own perspective and in their own regions. It's also, I think, fantastic to highlight the opportunity, the positivity. Climate change is such a daunting issue, and it's so easy to think that it's impossible to despair, but really there's room for hope. Urbanization is an opportunity, urban lives are an opportunity. COVID, for all that it's a horrible tragedy, can also be an opportunity for the future. And I think that this idea of opportunity has come out across all of the presentations and all the speakers. So I'm glad to see that. Now we have about 25 minutes left for questions and discussion. We have 90 or so participants. I hope to see 90 or so questions, and I'll prioritize the questions from the audience. So let me start from Carlos Dora. I'll read these off as they are. Agreeing with Juan Rivera, we especially need lessons on how to create the transformation toward the vision that was so well represented by the speakers. Let's have more science and good practice, initiatives on organizing and mobilizing urban stakeholders, science on what motivates and enables population groups to take action, including accountability mechanisms that speak to and engage people. How do we close the gap in that type of knowledge and experience, the knowledge and experience to motivate and engage and make people move? And maybe I will start with Dr. Rivera on that question.
Yeah, so that question followed my answers to two questions that I had. One is, if we want to implement, to make these changes, usually you have pushbacks and interference from big food and big agro-commercial businesses. And the question was, what to do? And the way we have been able to overcome those big pushes in Mexico is through the collaboration between academia, civil society, and then to find champions within the government. And we were able to pass a tax, to pass warning labels, to ban glyphosate, for example. However, they are very strong, and we need to regulate them. And once you have regulations, they comply. They usually comply. And the other question was the price of the Eat Lancet Commission diet. So somebody said it's too expensive. In Mexico, we did a very careful study, and it's interesting. Currently, the current diet is more expensive than the Eat Lancet diet, because if you remove a lot of the meat we eat, then the price goes down. But that's not the case in every country. And of course, you need instruments like subsidies or taxes to help people have a better diet. So I think that that really summarizes what I answered before, and I hope that will be useful.
Great, thank you, Juan. Renzo, would you like to say anything about this? Motivating and engaging people?
Yeah, well, regarding the planetary health diet, as I mentioned, there's really a very strong and growing interest, for instance, in the Philippines, to promote it. There's already a government supported initiative that I showed to you. And so it's really important to have, open conversations across disciplines. The Planetary Health Philippines that we created, as I mentioned, is interdisciplinary, also intergenerational. I think we need to involve young people because they will be the leaders for the next 50 years. They will be the consumers for the next 50 years. And oftentimes, unfortunately, when we try to design the next city or reshape the food, ecosystem, it's always and no disrespect meant to our more senior and esteemed colleagues in the room, or in the Zoom rather, but we really need intergenerational conversations because they will be the ones to pick the baton once it's their turn, and also really move this to the next, to the future.
Thanks, Renzo.
Yeah, I'd love to add to
Okay.
this as well. I mean, I think that just to exactly follow on Renzo's point, I think there's such a disconnect between the science that's taking place in research institutions, in universities, and what's happening on the ground. I think this was a question that was raised by many people in the chat, in the Q&A. And I think one of the most immediate things that we can do is to identify how these things like climate change, like let's say diet, affect individuals. Because I think that that is one of the big disconnects. People say, oh, climate change is this thing that's happening out there. It's going to happen in the future, but they don't understand how that affects their lives right now. And to say everything is connected to everything else is very complicated, right? It doesn't give them actionable items tomorrow or even today. And so I think linking, whether it's climate change or diet, to how it actually affects their lives today and what they can do today, I think is really important. I think the other thing is that, and this is again linked to Renzo's point about the younger generation, is we absolutely need to rewrite textbooks. Because what students are learning, what the younger generations are learning, there's not the climate change is not seen as a urgent crisis. It's seen as this thing that's in the science books for maybe one little chapter, maybe it's a little paragraph, and so there needs to be a rewriting of not just science books but materials that reach the younger generations. That's really, really urgent.
Great.
Can I just add on to that as well? Yeah, so I think in addition to seeing how climate affects people today and also in the future, we also need to understand what other things are affecting them, how they're prioritizing these climate risks, for example, against other priorities in their life, which they might see as being more urgent, even though they might be more short term. So I think that this holistic picture of the things that people are facing and the understanding of their lives and lifestyles and how they formulate their decisions is really key. And I think the only way we can really do that is to work with people, and this is like the different levels of stakeholders, the people, the residents themselves, but also the private sector and different kinds of policymakers, as well as other researchers. Thanks.
Thanks, Heidi. Really important, the idea that we have to tackle complexity, but also reduce it for people so they can meet the challenges where they are. Our next question from Egosa Akazi. First, thanks to all the presenters. And Egosa asks, how can we begin to create and implement transformative policies that going forward can improve well-being and the built environment in secondary cities in the global south, sub-Saharan Africa especially, and also in the context of climate change issues. And so maybe, Heidi, you'd like to take this one on.
Sure, I'll go back to like what I maybe just said. I think that transformative policies, they're challenging, and it means looking forward. It also means changing governance structures and maybe the way that people and organizations are used to dealing with each other, but also maybe these power structures that are in place between different organizations or different organizations even within an organization. And so I think that in order for transformation to happen, those things need to be looked at. But that's a really big challenge, because obviously the people or the organizations that do have an upper hand in decisions are not as willing to let go and transfer power to other organizations. So I see that as a challenge, but I think that that's something that's necessary to look at.
Great, thanks, Heidi. So that we make sure that we get to all of the questions. From Monica Masariegos, well, Leticia recommends a paper here for Dr. Rivera and everybody else interested in food, so take a look at that. For Monica, Dr. Rivera, have the greenhouse emissions of different dietary patterns been assessed, or just the GHG emissions of different food groups? So dietary patterns, so as in Western diet versus Mediterranean, for example, or other diets.
Yes, Monica, thank you for the question. Yeah, well, we have characterized very well the impact of different foods. And there are certain diets that have been studied, like the Mediterranean diet. There is a study looking at an average Occidental diet. In Mexico, we are currently looking at the current Mexican diet compared to an adaptation of the planetary diet to the Mexican situation. And we have been doing analysis, of course, based on a lot of assumptions, let me tell you, because at the global level, we have one figure, but then at the local level, the food systems are very different. And we have to make a lot of assumptions, but we are really getting very good information about the impact, not only of foods, but of different diets. And I think that that's really needed.
Great, thanks. For Dr. Cito, you mentioned the shift that we need to make to foster more adaptation measures in people's homes. How do you think these changes can be fostered for existing residences, so for retrofit? Is it through subsidies, increased awareness? What are the mechanisms that make the retrofit happen? Easier to implement initiatives in public space, harder in people's homes.
Yeah, well, raising awareness is key, right? Understanding. So the point that I was making in my talk with regard to this is that with climate change, but also with further urban development, we're expected to see that nighttime temperatures are going to increase. And so that's where we're going to need more adaptation at the household level. So the strategies for increasing adaptation is going to differ by household. It's also going to differ by city. And so we're going to need a multi-pronged strategy. So high income households, one adaptation strategy may be better insulation. It may be air conditioning. That's something that's a lot of more middle income to higher income households. That's already their adaptation strategy, right? Turn on the AC when it gets too hot. I'm sure that's happening in Manila as well. But for many, especially low income households, especially low income cities, that's not going to be a strategy, right? And so how do we think about effective strategies that can increase adaptation, not at the household level, but across the entire city? So that is going to require, maybe it's through subsidies, but likely it's going to require more public as well as private partnerships to retrofit a large number of homes. In some cases, I am going to imagine that it may require a movement of neighborhoods, of people as well. And that's something that a lot of people don't want to talk about. I mean, that's you just that for a lot of people, they don't want to think about having to move. But as we heard from some of the speakers, cities are sinking, deltas are sinking, and if you combine that with increases in temperature, both daytime and nighttime temperatures, there's only so much that we can do in terms of adapting.
Thanks. That's great. And it really speaks to the idea that in many ways, adaptation is a much more place-based and hyperlocal issue than mitigation. We have to find ways to get science applied to those questions. And again, not just meet people where the messages are and can have their greatest effect, but also make sure that we're solving the problems that really need solutions. Okay, so I think the next question probably everybody can speak to some extent, but what role can design thinking play in addressing pressing future challenges discussed today? So this reflects both the importance of cultural action. The importance of cultural actions as a means of effectively realizing change. These are essential as a mechanism for locating science-based thinking. Maybe I'll go to Dr. Guinto first.
Yeah, and actually it relates to what I would like to add to Professor Cito's comment about adaptation. Design thinking is really putting people and humans at the center. And in urban health and urban design, it's always been our complaint that cities for the longest time have been designed for cars and for buildings and not for people. And so, I think design thinking will really help even reorient the way we do urban planning, urban design, and even urban health, especially in the context of climate change and planetary health. And in relation to adaptation and linking it to design thinking, we always tend to focus on the hardware of adaptation. For instance, is there a seawall? Are the houses being elevated, so that they don't get inundated? But we forget about the software of adaptation, and that is people, that is communities, that is educating children. For instance, and then of course we don't want people to eventually will need to swim because of being in flooded areas. But we know that swimming lessons, for instance, is and could be a very good adaptation measure, again, in preparation for some future impact. So let's invest in the hardware, the infrastructure, and all the more we need to invest in the software, in the people, in the communities, especially the next generation who will be unfortunately facing the many things that we are right now presenting in those graphs. In the next 20 to 50 years, they will be realities, unfortunately.
Thanks. I would add that one element of design thinking, I think that we don't grapple enough with how much sociality and beauty and spirituality and creativity motivate people, and how important those can be in designing interventions and designing the way that we live and work for health and for environment. But let me take the next question. I see that we have about 10 minutes left. So how can we, this is another question on food systems, how can we ensure that dietary guidelines and policies do not place European, for example, Mediterranean diets as better than indigenous and cultural diets and foods, while still promoting health and environmental sustainability? Telling the world to adopt diets that are dictated by research coming from high-income countries seems like dietary colonialism, and could be inequitable considering that high-income countries are creating the most GHGs. So Juan, if you'd like to take that one.
Yes, well, that's a very good question. And, dietary colonialism is a very good term. And I completely agree. In Mexico, and this goes along with Central America, we are thinking a lot about what we call the Mesoamerican diet. So we had a very good diet that was based on what we call in Mexico, la dieta de la milpa. That means the diet that is based on corn, beans, squash, and pepper, all of them produced in the same land. So you have a variety of plants in the same land with small amounts of animal source food and, whole grain tortilla. The way we produce the tortilla is really whole grain. So we are now working in Mexico in our dietary guidelines. They were only based on prevention of illness or health issues, and we are now taking the perspective also of having a diet that is good for the health of the planet. And we are, of course, trying to recover a lot of our original diet that was really very healthy. So I really think that we should take an approach of recovering local diets that usually were very, very good.
Right. Can I just add to the colonialism aspect? I was just, stimulated because I'm an ardent advocate for decolonizing public health, global health, and even planetary health. And it's not just in the diets where, neocolonialism is manifesting, even in climate action, right? In fact, this morning there was an article that was tweeted saying that if we will replace the traditional wood-burning stoves in sub-Saharan Africa alone, we can offset the carbon emissions of high-income countries and in North America and Europe. And so I responded, so we want the low-emitting countries to emit way less further to allow the high-income countries to keep business as usual. And so I think we need to make sure that in our approach, we're decolonial, and really equity at a local, but also at an international level really underpins our work. So if we want healthy cities and climate smart cities, it should be for all and not just for some.
Really important point. And so thanks. One final question, Vanessa Agudelo. In my country and many others, basic rights are denied, including rights such as health, food, breathing, and breathing clean air, to name a few. When we seek urban resilience, we articulate actions to mitigate and adapt to climate change, to fulfill rights and social justice, and we talk about empowering communities. But when they empower themselves and protest for change, the response of governments is often cohesive and repressive. In these kinds of contexts, what are the things we can do to reach decision makers and to sort of transform business as usual? How do we get past the resistance of governments in some contexts to allowing communities to have power and to taking action? Perhaps, Karen, would you like to take that one? It's a difficult question. Or if anybody else would, that's fine too.
I could start.
Okay, Heidi.
Or Professor Rivera, do you want to go first?
No, please, Heidi.
Okay, yeah. I was just going to say, I think that the kind of organizations or people and maybe public organizations is pitting against each other. It comes from as a reaction to there not being collaboration. And so I think that if in the beginning of processes, or maybe as part of regular work, because it has to happen earlier on in processes, if there is this kind of creating a shared vision, then you can move together and move forward towards the same aims and same goals. But obviously that requires a change in the way that we do things, and thus it's hard to start, at one point to do something very differently. But I think this trust building can happen over time as well. Thanks.
Dr. Rivera.
Well, I just wanted to add that I think that in general, when we need a policy action, we need to foster the demand for policy action. And I think that academia and civil society can really push through the media, through advocacy in the legislative branch of power. When you really have a demand for a policy, then politicians listen. The only thing that will a politician do is something that is good for his political career. And the only way to do it is to push, society to request or to demand those policies.
I think this is where you absolutely need to get the private sector involved. And when I hear that governments are responding in cohesive or repressive ways, right? I mean, I just don't think that civil society is going to be able to put pressure on these governments to actually change. This is where you actually need to get people with the purse strings, with the power, money, investors, to actually divest and to put financial pressure on these governments, because as Juan Rivera just said, their goal is to stay in power, and so I think really putting pressure on the private sector will be essential.
Certainly, understanding policy processes and understanding the levers of power is a hugely important thing for us. So we're almost out of time. I want to give each of the panelists maybe 30 seconds to give a last word if they'd like to do that. And I will start with Renzo.
Well, if there's one virus that we should be spreading now, it's the virus of planetary health. A planetary health approach to our contemporary challenges: climate change, biodiversity loss, urbanization, air pollution, health inequalities, and preventing the next pandemic. So planetary health is the way to go. Thank you. Thank you,
Renzo. Hey, Heidi?
Yeah, so I think I'll just continue from this user-centered approach. I think it's a good approach, and also improving the capacities of these communities to actually be engaged in these policy processes is important. Thanks.
Thanks so much, Heidi. Dr. Cito?
Cities are at the center of many planetary challenges, right? And so part of our challenge going into the future is to raise this level of awareness to policymakers that urban challenges are not just about what's happening at the city level, but if we think about the planet, we need to think about cities and urbanization.
Thanks so much. And Dr. Rivera?
Well, if we don't really take it seriously, and if we don't reduce the greenhouse emissions and improve the health of our planet, our own species is in danger, and the planet as we know it is in danger. And I think that this is a very important message to convey to everybody.
Thank you so much. So I think that we're exactly on time. We've come to the end of our time. It's been a fantastic session. Thank you so much to the speakers. It was really interesting. Thank you to the audience. It was very responsive today and lots of questions. Thank you to the ISUH and to our sponsors. I think that we ended on a message of both responsibility, that we have a lot of work to do, but also of hope and opportunity. And I think that's the right place to be. So thanks again. And I look forward to engaging with you all again soon. All best.
Bye.
Thanks. Good night.